слово. You want.
You try.
I can try, Professor. I
Yes,
think
yes,
he
yes.
has problem
Yes.
with
Try.
coagulopathy.
No, coagulopathy is the therapeutic diagnosis. In this task,
Yeah.
must be gynecology diagnosis. You know only two pathology. Myeloma, yes, and maybe something inflammation. Yes. Besides this is very many other pathologies. For example, хорошо. What data you must think this is coagulopathy?
She has a history of bleeding, Professor.
She has bleeding, yes,
Yeah.
maybe then.
Like his hemoglobin is very low.
Yes, hemoglobin is less, yes, then.
I can see frequent tonsillitis, Professor.
Tonsillitis.
Yes, Professor.
Yes, maybe it's very interesting, but this is we must to think this diagnosis in the ring of different diagnosis.
Differential diagnosis.
This is differential diagnosis. Yes.
Okay.
And the main diagnosis what? What? The next student. Where is your small friend? No, small friend.
Michael.
Oh, Michael. He has problem.
Where is he?
He has problem with stomach.
Yeah, stomach pain. Yeah, gastric, Professor, sorry.
Yes. The next.
I
What
also
do you think?
Menstrual dysfunction.
Menstrual dysfunction. No, it's not named, and it's correct name by pathology. What's the correct name of this pathology?
functional.
It's very clear. Abnormal uterine bleeding. Abnormal uterine bleeding. No, they are old name. Dysfunctional uterine bleeding. Modern abnormal uterine bleeding. The differential diagnosis is coagulopathy. Then differential diagnosis. What? What?
Vaginitis.
What?
Vaginitis.
There's no infection.
Infection.
There's no.
No.
Vaginite.
Yeah.
Vaginite.
Yeah.
Good. Yes. Then
Polycystic ovary syndrome.
polycystic ovary syndrome. Yes. Then. Thus, we know that there are four pathology. Yes, four pathology. Abnormal uterine bleeding, coagulopathy, vaginitis, and polycystic ovary syndrome. Yes. What the data for polycystic ovary syndrome? You. What the data? Why do you think?
Delay of menstruation for 60 days, weakness, there's no.
Duration of the menstruation. Yes.
Yes.
Yes. There may be, but irregular. Maybe there's
Late menopause. Delay menang.
Delay menstruation.
Delay
What?
menang.
Delay.
Her
Where is
15 years old for the first
50 years, yes, then.
The duration varies.
Yes, what the typical clinical symptoms of polycystic ovary? There, acne, there, where is acne? No, then, obesity is here. No. What? No, acanthosis is here.
No.
No, then the ovary is some bigger. Yes,
Yeah.
then where is ovary? The appendages of the uterus are not defined. There is no bigger, this is normal size. Because we must exclude this diagnosis. Yes? Yes. Then coagulopathy. Coagulopathy, what? Coagulopathy, what data for the pathology coagulopathy? Anemia, yes. The duration of bleeding.
Yes.
Yes. Then
There is tonsillitis, Professor.
tonsillitis, yes.
Yeah.
Yes. This is maybe, but from what pathology we must be cured? From coagulopathy or from abnormal uterine bleeding?
I think from coagulopathy, Professor.
We must blood test, yes? And coagulation test and so on and like that. Yes?
Yeah.
We have not enough data for cardiopathology. Yes? Yes. Then go. What's about your diagnosis? Vaginitis.
That is because she has
Where vaginitis?
bloody discharge.
Blood discharge from the vagina.
Yes.
Yes. And in the diagnosis vaginitis, we must to observe the wall of vagina. This we can because there is a girl, only girl, without any sexual life. No, why the girl without any sexual life have inflammation?
Because like she not every day to change
No, it's
something.
very.
In hygiene, maybe.
In hygiene.
No, it's very difficult to see. Yes, exclude. And at last, we must know, we must think about the diagnosis of abnormal uterine bleeding. Yes?
In puberty.
Yes. Only the complaints of this patient, the physical data include confirmed the diagnosis of abnormal uterine bleeding. Yes? Do you agree or not?
Yes.
It's clear or not?
Yes.
Yes. Necessary research method. What? Ultrasound. Ultrasound by the abdomen volume. By the abdomen volume. No vaginal, by abdomen volume. Yes. Then medical tactics. What must we do to cure? Yes, conservative. Yes, conservative. In all cases of abnormal uterine bleeding, we must, the first stage is to stop hemorrhage, and then we must regulate menstrual cycle. 2 steps. The first step, what must we do?
Stop bleeding.
Stop. Stop bleeding. How?
Anti-hemorrhagic. Use anti-hemorrhagic drug.
One student.
Anti-hemorrhagic drugs.
Anti-hemorrhagic drugs. Maybe
Bifenol.
Ditsanol.
Mm.
No, maybe no. This is not very effective. We must some more effective.
We can give heparin or warfarin.
What? What? What drug?
Heparin or warfarin. Clopidogrel.
Слушай, я не могу слышать, когда говорят сразу несколько. You must speak only once, student, and loudly. Say, please.
We can give heparin,
Anticoagulation.
anticoagulation medicine.
It's contraindicated.
As contraindication?
What drug?
Warfarin.
Heparin.
Yes.
Yes.
Heparin.
Yes, Prophet. Of clopidogrel.
Вайник. Ну, русский язык очень богат всякими местоимениями и так далее. В данном случае, конечно, подошло бы такое очень хорошее выражение, после которого все бы смеялись. Но поскольку мы находимся в академических стенах, я не имею возможности использовать. Да? Поэтому я просто говорю, ну а зачем гепарин? If we take heparin, the hemorrhage is bigger.
Maybe transaminase.
What?
Transaminase.
Transamin, yes, transamin acid. Ditsinol, maybe, but is not enough. What the drug is stopped bleeding.
Clopidogrel.
What?
Clopidogrel.
Oh, I don't understand.
Clopidogrel.
Clopidogrel. In Russian, what is it in Russian? Clopidogrel.
Вот. А?
Ну, говорит флокодрин, но это как по-русски, не знаю.
Еще раз, как называется лекарство? What the name of drug?
It's clopidogrel.
Yes.
Progesterone. You can also use progesterone.
Adrenobazon.
You can also use
Наберите, что он говорит, я никак не пойму.
Ну, имя. Это
Имя этого препарата называется...
который по-английски называется клопидогрин. Где-то так. Ну, клопидогрин.
Нет, ну давайте выясним, что за препарат. Может, я не знаю.
Да,
специалист.
он сейчас... So may you explain, please?
What the drug?
For stop bleeding.
Just for
It's a blood thinning drug.
For stop bleeding, adrenobazon.
What?
Adrenobazon.
Да?
It's a pro-drug.
We cannot use it.
Yeah,
We
it's
can
no,
use
no,
it.
no, no.
Yeah.
It's not effective.
It's not
Как
effective.
аспирин?
А, аспирин?
Как? Похоже. Это аспирин.
Ну, это наоборот. Это увеличает.
Вот, аспирин is active for bleeding.
It's increasing.
The bleeding is big.
Yeah.
Not this drug. It's not this drug.
Oral contraceptives.
Yes, it's very good.
Yeah.
Progesterone.
It's very good idea. Oral contraceptive.
Yeah.
We must oral contraceptive. The main drug in this contraceptive is estrogen. We must estrogen for hemostasis.
Okay.
In modern situation, we must to take, we must to do to acting oral contraceptives, oral contraception, oral contraceptives. In the first day of our treatment is 5 tablets. 5 tablets. Вы это проходили на 5 курсе?
Да.
Да? Да. Это типичная задача, да. Because this is only girl, and without any inflammation и так далее, да. In the first day, 5, the next day, 4, the next day, 3, 2, 1, and the length of the
5 days.
preparation, no,
Well,
is the length of use this drug is
12.
21 days.
21.
21 days. Because the contraceptives, all women bring with in 21 days. More often 21 days. And this we our patient must receive 21 days. Then we stop this drug. There is menstruation, similar menstruation, and after that we must to treat. What treat? With similar preparation. What? Oral contraceptives by 3 months. 3 months.
For treatment.
At this period, we must to do physical and instrumental observations about coagulopathy, about blood test, and so. Yes? Yes. And after that, after 3 months ago, we must to observe about health, we must observe health of this our patient.
Yes.
3个月就要写，这3个月之后就已经健康。
Так, basically for you. Yes.
用药用的是这21天。
Так,
就用的这
just
个。
number 6.
Excuse me, sir. What is the next second step?
Huh?
Second step.
Second step.
Here for
Second step, oral contraceptives, 3 months. Yes. The first step is stop bleeding, and then we must cure this situation. Так, clinical task number 6.
Menopausal abnormal uterine bleeding with diabetes mellitus and anemia and hypertension.
Yes, diagnosis, the whole diagnosis, correct. You, what?
Abnormal
Abnormal uterine bleeding. Yes.
Menopausal with diabetes mellitus.
Yes, abnormal uterine bleeding of perimenopausal period. Perimenopausal period. There are different diagnoses is maybe what?
Endometrial hyperplasia.
What you are this only pathology that you very like. Myoma, endometriosis, inflammation, and so on. Так, because what must we do about this diagnosis? What data confirmed this diagnosis?
Yes, because of the age first, and then there's
Age, yes.
profuse bleeding and 4 weeks in delay in menstruation.
Yes.
Intense. And she took anti-hemorrhagic, but it doesn't work, so it becomes worse. And
Yes, there.
And then irregular periods for 1.5 years, it means that she's about to get to menopause. And she also has endocrine disease and also hypertension.
No, there. By gynecologic examination, what data confirm this diagnosis? palpation without any
Finding.
normal,
Yes.
without any abnormal.
Only this.
Only normal. Only normal. Yes, necessary research methods. What?
USG. Ultrasound.
Ultrasonography. By vaginal approach. Yes. What? Medical tactics. What must we do? The first stage.
Stop bleeding.
The first stage. What? To stop bleeding.
Yes.
What must we do in this?
Oral contraceptive.
No.
Progesterone. Progesterone. Estrogen.
No. What?
Estrogen.
No. What must we do? To stop hemorrhage. What?
Oral contraceptive.
She's
What?
already.
Трансамин?
HRT.
Maybe transamin, dicinone и так далее. The main step to stop hemorrhage. What? It's very clear. It's very simple. What? No one. Remove.
Laser.
The problem is not.
We must know. In these cases, of all patients after their 30 ages, we must to stop hemorrhage. One method, hysteroscopic and curettage of the uterus.
What should we do again, sir?
Hysteroscopic and curettage. Separate curettage of the mucous cervical channel and the uterus. Curettage. Yes. Why?
Why? To clear. To check whether there's a.
Because in this endometrium, what the morphological pathology may be in this endometrium, in this situation, what may be, what histological changes in this endometrium?
The capillaries are weaker.
Yeah.
What?
The blood supply.
Какая атрофия, да? вы чего? Perimenopause, yes. Perimenopause, да. 22 years.
Oh, not
Ой,
52.
52 years, yes, 52, да. What? What we hope, what the morphological structure of endometrium. No, it's very simple, it's very clear. Hyperplasia, yes, hyperplasia, complex hyperplasia, atypical hyperplasia, and then what?
Endometrial cancer.
Yes, yes. Do you understand?
Yeah.
Only these, only without any oral contraceptives. Какие контрацептивы 52 года без знания гистологии эндометрия? We must the first stage curate. Then histological structure of endometrium. Then we must to cure drugs. What drugs? Only progesterone-like drugs. Narcolepsy, medroxyprogesterone acetate, and so on. And if the atypical hyperplasia, no, we must think about the surgical treatment. In volume, yes, panhysterectomy, maybe,
Thanks, sir.
yes. It's clear for you?
Yes.
Да. Мгм. Так, Task 7.
Policies is very similar.
What's the diagnosis? Polycystic ovary syndrome. Yes, maybe it's very, this diagnosis very with hope, very hope. Yes. What data confirm this diagnosis?
Growth of stem hair in the areola and upper lip, acne and nigrocanthal.
Yes. Uh-huh.
And also
Yeah.
pupil symptom.
Then irregular menstruation. Yes. Yes. Histological examination of the endometrium, endometrial hyperplasia without atypia, and so on. And by gynecology examination, we know these
And large ovary.
ovaries, yes, 6 to 7 centimeters are palpable. Are palpable. What must we do? No, at the first stage, we must to improve this diagnosis. By what? Ultrasonography. Ultrasonography, by what? Vaginal approach. Vaginal approach. Then we must
Do blood test to measure the hormones.
hormonal test, blood test, and so on. Then, так, about weight. Is there obesity or not?
Yes.
Obesity, yes. The first stage we must to
Reduce the body
yes,
weight.
obesity.
Yes.
And after the treatment, maybe menstruation is regular.
Yes.
If this is not effective, we we can use oral contraceptive. Yes?
Yes.
About 4 to 6 months. Yes? We observed, yes. After that, because our patient maybe realize reproductive potential, yes, we must think about the next step. What the next step? Last lesson we discussed about.
Professor, is it possible for a patient to take metformin?
Clomiphene.
Metformin.
Yes,
No, metformin, this is parallel drug. Yes,
Okay.
yes, that. And if not effective, we must use clomiphene.
Okay.
Clomiphene plus tildigit, no, name international. Yes. About 3 months. In the first months, we must with 50 grams, then 100, then 150 milligrams. 5 days. 5 days. That's 3 times, 3 months. And if there is no effect, there is no ovulation, we must think about surgery. About surgery. What surgery? Laparoscopic drilling, yes,
Oh, yeah.
and laparoscopic resection of ovary. It's clear for you. Without any myoma and endometriosis. Ну, вы так любите эти диагнозы, да? Так. The task is number 8. Так. Ага. Infertility.
Because of
Who wants to tell diagnosis? No, it's very simple task. About inflammation.
Yes.
Good. No? The first place is infective. Yes. Then, what nature? Infectious. Yes, infectious. Infectious what? Gonorrhea, chlamydia, mycoplasmosis, and so on. Yes. Then we can note ectopia on the cervix. This is shown to infectious, and then we palpate formation. 8 to 4 and the 7 to 3. What they are formations? So, what formations? In appendix, what organ include in appendix?
Ovaries.
Ovary and ovary and tube. Yes. What formation? From what organ? Yes, tube. Tube. What is there? What is there?
No.
His husband.
Sacto sapiens. Sacto sapiens. Sacto sapiens. This is fallopian tube is not closed in one and in uterine and abdomen. Yes. And what must we do in these cases? How we can help to this patient realize reproductive potential?
Antibiotics.
No antibiotics at by the way. Yes, yes. What? In vitro fertilization. In vitro fertilization, and if this procedure is more effective, we must remove sacto sapiens. Sacto sapiens.
We have to repeat it. It's not a
Sapto something.
How to
How to write this? I don't know. I'm not sure, but it seems like.
Расширенная труба, very serous liquid. In these tubes, only serous liquid,
Something like that.
not inflammatory. But we must exclude
Let me
these
check
tubes
his paper.
because oocyte
Cannot get out.
maybe no, in uterus, we bring to uterus, and after that they can to tube. And maybe extrauterine. We were told about this. If there are sacrocytics, we must remove fallopian tubes.
And store.
How can we how can we confirm this data? We must ultrasonography. Yes. It's clear for you.
Yes.
Interesting tasks.
Yes.
Yeah.
Yes.
Like detecting.
Yes. Have you any questions? The next lesson we must discuss some questions about infectious keep silent. Keep silent. We must discuss the questions about female inflammatory disease. 3 or 4 reporters.
Okay, who wants to do presentation, guys?
And besides, you must make up tasks 9 to plus. 9, 10, 11, 12, 13.
Explain.
No.
Take 1 to
Yes, yes. So